Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session or this lecture is about reproductive health documentation essentials, which is part of chapter 27. And chapter 27 is about, or the topic for the chapter itself is review of OB GYN, which is obstetric or obstetrician or obstetrical, and gynecological or gynecology scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. As reproductive health encompasses a wide range of sensitive and vital medical care, including contraception, prenatal and postnatal care, fertility treatments, gynecologic conditions, sexually transmitted infections, STIs for short, and menopause management. Accurate and comprehensive documentation in this area of medicine is critical to ensuring safe, effective, and patient centered care. For advanced medical scribes, mastering the nuances of reproductive health documentation is essential in supporting healthcare providers while maintaining the highest standard of care. The unique challenges of documenting reproductive health cases stem from the deeply personal and complex nature of the subject matter. Patients often share intimate details about their physical, emotional, and sexual health, which must be recorded with utmost sensitivity and respect for their privacy. Medical scribes must adhere to stringent confidentiality protocols not only to comply with the privacy laws like HIPAA in USA, but also to build and maintain patient trust. This requires a clear understanding of appropriate documentation practices, particularly when sensitive information such as contraceptive use, abortion history, infertility treatments, or postpartum depression is part of the clinical record. Beyond sensitivity, reproductive health documentation demands precision. Reproductive medicine often involves intricate medical histories, multiple diagnostic tests, and detailed treatment plans that must be meticulously captured for every patient encounter. Failing to document critical details such as menstrual irregularities, previous pregnancies, or genetic risk factors could directly impact clinical decision making and lead to adverse outcomes. For example, in prenatal care or antenatal care, omissions in capturing information about prior complications like gestational diabetes or preeclampsia could significantly affect risk stratification and management strategies. As reproductive health documentation also presents linguistic challenges, medical scribes must become familiar with a range of specialized terminology, from obstetric abbreviations like GTPAL, gravity term, preterm, abortions, and living, to gynecological terms describing conditions such as menorrhagia or pelvic inflammatory disease, for short PID. Understanding this language allows scribes to craft comprehensive and standardized notes that support interdisciplinary collaboration and ensure clarity in medical records. Furthermore, documenting reproductive health often requires exact coding for procedures like in vitro fertilization, IVF, consultations, or cervical cancer screenings, which has implications for billing and regulatory compliance. A key responsibility of scribes in reproductive health is to ensure proper communication between healthcare teams as providers across disciplines such as gynecologists, endocrinologists, urologists, and mental health professionals often collaborate on a single patient's care. Scribes act as a bridge by ensuring all relevant details are accurately recorded and easily accessible, promoting continuity of care. Additionally, given the legal and social implications of many reproductive health decisions, scribes must document care discussions meticulously. noting informed consent, treatment plans, and follow-up recommendations. Key points: maintaining confidentiality, adhering to privacy laws. Medical scribes must ensure all patient information related to reproductive health is documented while complying with privacy regulations, such as, for instance, HIPAA in USA. This is particularly critical given the personal and sensitive nature of topics like contraception, infertility, and STIs. Proper safeguards must be applied at every stage of record management to keep patient details secure. Example: when documenting a patient's decision to undergo an elective abortion, scribes must ensure that access to the record is restricted appropriately, ensured only with authorized personnel involved in the patient's care. Building patient trust. Confidentiality is pivotal to fostering an environment in which patients feel comfortable sharing sensitive information. Scribes are responsible for recording details in a way that protects the patient's dignity while preserving the integrity of the medical chart. Example: a scribe handling documentation for a young adult seeking contraceptive advice that ensures the language used in the chart is factual and non-judgmental, maintaining a professional tone that reassures the patient. And here is a summarized diagram on ensuring confidentiality in reproductive health. Documenting consent. Reproductive health often involves procedures requiring informed consent, such as sterilization, IUD intrauterine device placement, or IVF in vitro fertilization. Scribes must be diligent in capturing the provider's explanation of risks and benefits, as well as the patient's acknowledgement of understanding prior to before any intervention. Example: during consultation for tubal ligation, the scribe records the provider's discussion of permanent sterilization risks and benefits and the patient's signed consent. Here is a summarized diagram on navigating informed consent in reproductive health. As on the left, informed consent; on the right, provider's explanation, patient's acknowledgement, procedure documentation. Using precise medical terminology. Understanding key terms and abbreviations, as reproductive health documentation requires a thorough knowledge of specialized terminology, from medical abbreviations like GTPAL, the one we explained earlier, which is short for gravity, term, preterm abortions, and living, to conditions such as endometriosis or polycystic ovarian syndrome or polycystic ovary syndrome, PCOS. Scribes must be familiar with the language that enables accurate and comprehensive notes. Example: when documenting an annual gynecological exam, a scribe uses terms such as pap smear, HPV screening, and cervical dysplasia to describe the services provided and findings assist. Avoiding ambiguity. Precision in language reduces the risk of miscommunication or misinterpretation of notes. Medical scribes must avoid vague or colloquial expressions and instead use standardized terminology to capture relevant clinical details accurately. As for example, a scribe documenting a menstrual irregularity note specifies menorrhagia for excessive bleeding rather than heavy periods, ensuring medical accuracy. Accurate coding for billing. Scribes play an essential role in assisting providers with the correct documentation of reproductive health procedures to align with billing codes. This ensures compliance with regulatory and insurance standards while supporting appropriate reimbursement. Example: for a patient undergoing IVF guidance, the scribe includes all coded procedures from ultrasound monitoring to fertility evaluations, facilitating accurate billing. Handling sensitive information. Documenting with sensitivity. Since reproductive health directly impacts patients' physical and emotional well-being, sensitive documentation practices are paramount. Information should be recorded factually and objectively, avoiding judgments or assumptions. For example, When documenting a diagnosis of infertility, the scribe objectively notes the diagnostic findings and the provider's discussion on treatment options, avoiding any language that could appear biased or opinionated. Recording patient-centered observations or productive health encounters often involve deeply personal conversations. Scribes are trained to omit irrelevant details while ensuring the notes reflect patients' reported symptoms, concerns, and emotional states where clinically appropriate. Example: a scribe documents a postpartum checkup conversation by noting the patient's verbal concerns about postpartum depression symptoms, providing this critical context without unnecessary narrative additions. Recognizing cultural sensitivity. Culture and personal values play an important role in reproductive health. Scribes must capture details that align with the patient's preferences and avoid judgmental language to respect diverse perspectives on topics such as contraception or fertility um, treatment or fertility treatments. Example: during a consultation, a scribe records the patient's preference for hormone-free contraception or contraceptive options based on cultural beliefs. Supporting interdisciplinary collaboration, coordinating among specialists. Reproductive health cases may involve interactions with multiple providers, such as gynecologists, endocrinologists, urologists, and mental health professionals. Medical scribes are vital in maintaining organized and comprehensive notes to ensure seamless communication between all patients involved. Example: a scribe supporting a patient with fertility changes integrates notes from the OB GYN and the endocrinologist to compile a cohesive record of recommendations and progress, facilitating transitions of care. Accurate reproductive health documentation is essential for transitioning care from one provider to another, such as when a patient moves from general practice or to a reproductive endocrinology specialist. Clear, detailed notes streamline the process and support continuity of care. Example: a scribe transferring notes for a patient diagnosed with PCOS ensures all past lab results and treatments are highlighted for the receiving specialist. Integrating holistic perspectives, reproductive health often intersects with mental health, family planning, and general wellness. Scribes contribute by ensuring these multidisciplinary aspects are reflected in the documentation, providing a comprehensive view of the patient's care. Example: a scribe documents the involvement of a mental health counselor during a patient's discussion about gestational surrogacy to highlight the multidisciplinary support provided. Summary tables. Here we have table on ensuring confidentiality in reproductive health, aspect description, example, importance, challenge. And the aspects here we have privacy laws, secure documentation, restricted sharing, emotional sensitivity, documenting consent. Here we have table on key medical terminologies in reproductive health, term or slash abbreviation, definition, example, application, risk of misuse. Terms or abbreviations: GTPAL, menorrhagia, PCOS, FSH and LH, and PID. As GTPAL is gravity term, preterm abortions living. Menorrhagia is excessive menstrual bleeding. PCOS, polycystic ovary syndrome. FSH, follicle stimulating hormone, while LH, luteinizing hormone. PID, pelvic inflammatory disease. Table on handling sensitive information, practice description, example, patient impact, challenge. Practices: we have factual documentation, relevance filtering, emotional context, diverse perspectives, and timeliness. Table on supporting interdisciplinary collaboration, role description, example, contribution to care, challenge. Here roles: we have coordination of details, transition assistance, reflecting inputs, collaboration notes, emergency context adaptation. Table on challenges: And solutions in reproductive health documentation, challenge description, example, consequence, solution challenges. We have complex histories, terminology missteps, privacy breaches, consent record omissions, and data redundancy. Next, we will revise what we have covered through this lecture via some MCQs or multiple choice questions. Question 1. Why is maintaining confidentiality crucial in reproductive health documentation? A. To adhere to legal requirements and preserve patient trust. B. To reduce the time spent on documentation by omitting sensitive details. C. To ensure easier communication between non-caregiving staff. Or D. To allow access to the reproductive health details by all hospital staff. Definitely the answer is A, as confidentiality is vital to complying with laws like HIPAA and ensuring that patients feel safe sharing sensitive information. Breaches of confidentiality damage trust and could lead to legal consequences. Question 2. What should a scribe do when documenting the medical history of a patient seeking treatment for infertility? A. Exclude personal lifestyle choices as they are not clinically relevant. B. Include the patient's details, GTPAL, history, and any prior diagnostic results. C. Use vague language regarding past treatments to avoid sensitive detail. Or D. Skip consent documentation as it is not part of the scribe's responsibility. The answer is B. To include the patient's detailed GTPAL history and any prior diagnostic results, as the GTPAL history and diagnostic results provide critical context for understanding infertility cases. Scribes must use detailed, precise language or for accuracy and care continuity. Question 3. How can a medical scribe avoid bias when documenting sensitive reproductive health topics? A. By recording all information verbatim, regardless of the patient's comfort level. B. By omitting emotionally charged patient statements. C. By using factual and non-judgmental language that reflects only clinically relevant details. Or D. By including the scribe's personal interpretation to enrich the documentation. The answer would be C. By using factual and non-judgmental language that reflects only clinically relevant details, as non-judgmental and factual documentation ensures clarity and professionalism, maintaining patient trust while providing accurate information for healthcare providers. Question 4. Which term is correctly associated with reproductive health documentation? Is it A. Hyperlipidemia for cholesterol levels, PCOS for polycystic ovary syndrome, GERD for gynecologic reflux disorders, for gastroesophageal, and this is wrong, not gynecologic reflux disorder. Um, GERD is for gastroesophageal reflux disease or disorder, GERD, or D, COPD for contraceptive planning, chronic obstructive pulmonary disease for constructive planning, or COPD if it's chronic obstructive pulmonary disease, then not for not for contraceptive planning, it's for respiratory disease, but maybe combined oral contraceptive pills could be, but COPD is not combined oral contraceptive pills. Combined oral contraceptive pills, yes, would be for contraceptive planning, but COPD is respiratory disease, and here GERD for gastroesophageal reflux disorder or disease. Anyway, for term that is correctly associated with reproductive health documentation is PCOS, B as polycystic ovarian syndrome or ovary syndrome, as PCOS is a common reproductive health condition requiring precise documentation using correct medical terms and lines notes with standard clinical terminology. Question 5. What should a scribe prioritize when supporting interdisciplinary collaboration in reproductive health cases? A. Rewriting notes from multiple providers for brevity. B. Highlighting critical inputs like lab results and specialist recommendations. C. Skipping documentation of mental health contributions to preserve focus. Or D. Removing summaries to save time for receiving providers. It is B, as scribes promote efficient interdisciplinary collaboration by ensuring key details are highlighted in the documentation. This supports continuity and avoids miscommunications across care teams. And here we come to end of this lecture. Thank you very much and goodbye.